Dr. Melissa Black of Empower Family Medicine. Next, I'd like to speak for a few minutes about common lab results. I'm going to show you an example of a typical lab report and some of the numbers that you see on your lab report, so you can know a little bit about how to understand your lab reports and what questions you might want to ask. So here is an example of the two most commonly run lab panels. One is called a CBC, or a complete blood count. That's what we see first on our lab report. This is a breakdown of the different types of blood cells you have. And there are really three main things we're looking at with this panel. The first listed is usually WBC, or the white blood cell count. White blood cells are cells that fight infection. So this should be within a normal range. There will always be a reference range given for the white blood cell count. It's important to know with lab results that every lab may have a slightly different reference range for each parameter. It depends on the lab itself and the type of equipment they use. So the reference range may slightly vary for all of these numbers that we're about to look at. That's why it's always included on lab reports. So here we see a white blood cell count of 5.6. You can see under units times 10 to the 3. So that really means 5,600. That's the white blood cell count. If we look at the reference range, we can see that for this lab, expected reference range is 3.4 to 10.8. So this person has a normal white blood cell count based on the reference range. When you're looking at reference ranges, they're a reference. They're not, they're meant to be a range of expected values. Sometimes I see a person with a value that's 0.5 above or below, or maybe 1 point above or below the reference range, and that may or may not be significant because they're still close to the reference range. It really depends on the person, their medical history, if I know what their prior baseline labs were, and what symptoms they're having. So there's a lot involved in interpreting lab results beyond just simply the number and the reference range. But I'm talking you through so when you're looking at your own lab reports, you understand a little bit. So if we see a person with a very high white blood cell count, then it's possible that they have an infection. There are other things that raise a white blood cell count. For example, anyone taking a steroid medication often will have a high white blood cell count. When someone is sick, particularly in the hospital, we may look at the trend in white blood cell count. So if we know and have diagnosed a serious infection and someone has a white blood cell count of 20,000, which is really high, we may be checking labs once a day to make sure that number is trending down. If the number is trending up and the next day it's 22,000 and the next day it's 25,000 and the next day it's 30, that may be a cause for concern. So the trend in lab work is very important. That's your white blood cell count. The next few numbers, RBC, hemoglobin, hematocrit, MCV, MCH, MCHC, RDW, those numbers are all describing a person's red blood cells. And some of these numbers are machine-generated measurements of what your cells look like in terms of the shape, the size, the color, and density. It's a computer scanning a microscope slide and calculating averages for those numbers. So if they're all in normal range, or even if one or two of those is slightly out of normal range, they have to be interpreted in context. The most important numbers to look at are the hemoglobin and hematocrit. Here we see a hemoglobin of 11.7, which falls within the reference range of 11.1 to 15.9. The hematocrit, 30, it's a little bit small on my screen, 36.4, with a reference range of 34 to 46. So when we look at hemoglobin, okay, a low hemoglobin would be anemia. So in this case, less than 11.1. Sometimes we expect some slight anemia. For example, older people often have related anemia. It's, again, important to know the person who belongs to these lab results, what their usual hemoglobin or hematocrit is that trending down or trending up from their usual baseline? Have they had a recent bleeding event that would explain why they would be anemic? For young women who have periods, they may be anemic for that cause. So there's a lot to think about when interpreting a hemoglobin and hematocrit. In addition to is it low, you have to look at the context of the person. You may be expecting it to be low. So if I have an older person whose hemoglobin is always around 10.4 and it's been that way for years, and we've ruled out any bleeding and treated nutritional deficiencies, it may be what we call anemia of chronic disease. And so I'm going to use that as a reference for that particular person. So that's hemoglobin and hematocrit. Again, the other numbers that you see require a little bit more advanced interpretation, but they're significant if the hemoglobin and hematocrit are abnormal. If the hemoglobin and hematocrit are normal and the other parameters are slightly off, that's less concerning. But there's a lot of knowledge and training behind interpreting those numbers. Again, if your hemoglobin and hematocrit are normal, that's reassuring that there's not a cause for concern. Next, after RDW, you can see platelets. Platelets are the blood cells that will stop bleeding. So if you cut yourself or you have a procedure or a wound that's bleeding, platelets form a plug to stop the bleeding. So a person with a very low platelet number is at risk of having potentially dangerous bleeding event. A person with a very, very high platelet number is at risk of having a clotting event, an unexplained blood clot. So the platelet count here is 327. The normal range is from 150 to 379. Typically, we say a person is not at risk of a dangerous bleeding event until their platelets are very, very low, usually less than 70 or maybe even lower. So again, when looking at platelet count, look at trend. If I see a platelet count is low, or really any of these parameters, most likely I'm going to repeat that lab to verify that it's a correct result and not a lab error, and look at the trend. Was it a temporarily low lab that's now improving?